This lady had an MRI report which stated that her right TMJ disc was anteriorly displaced. She had an osseous defect in the right mandibular condyle due to arthrosis, severe limitation of range of motion of the left condyle. Her clinical information was right torticollis and cervical dystonia. She suffered from sleep apnea and has been using a CPAP for the last 10 to 12 years. She has difficulty swallowing, bilateral face pain, right jaw pain, bilateral suboccipital pain, bilateral neck pain, and bilateral shoulder pain. She had bilateral TMJ popping and clicking. Her maximum interincisal opening was only 43 millimeters. She suffered from photophobia and loss of equilibrium. She had right tinnitus. After she was in treatment for a short time, she revealed to me that she used to be an invalid in bed all the time. Now she has lots more energy, she sleeps better, no more headaches, no more right jaw pain. I'm much more active. I'm taking water aerobics. This is this patient's cephalometric x-ray. She has an airway of average width here. This is the type we usually see. Notice the elevation of C1 here and a total compression of the suboccipital tissues. There is no 14 millimeter opening between the undersurface of the occipital bone and the top surface of the first cervical vertebrae. Notice the non-parallelism of her mandibular borders, indicating a temporomandibular joint problem, usually on the side above the higher border. Notice this protrusion of her upper teeth, but this is really not a true protrusion because her upper lip drapes down and is not protruded forward with the teeth. What this really is a distal displacement of the mandible. The mandible is too far back posteriorly. This is this patient's MRI. This view shows the anteriorly displaced disc. This is on the left side. We can tell that this is the patient's left temporomandibular joint by looking at this icon that is put in the upper right-hand corner, which shows the slice that the MRI is taking of this patient's joint. This is the image through there. It shows the anteriorly displaced disc in black with a white area of inflammatory fluid in the superior compartment overlying the disc. This is an MRI of the patient's right temporomandibular joint. We look up here and confirm that it is on the right. This is the condyle, and you can see that the disc is in place on top of the condyle, but you can see that the superior surface of the condyle is being eroded and some cratering is forming. This is on the lateral pole. You can tell it's the lateral pole because of the vertical fibers of the temporalis muscle. This is another view through the left temporomandibular joint, showing the anteriorly displaced disc with the inflammatory fluid in the superior compartment. This is another image through the lateral pole of the right temporomandibular joint. We look at our icon to confirm it's on the right side. You can see this black area on the top of the condyle, which is a little area of osteonecrosis, which means this area is getting no blood supply and this bone is breaking down. This is one of the initial steps you'll see in the cratering process. This is another MRI image through the right temporomandibular joint. You can see the cratering process right here at the end of my pointer. You can see the anteriorly displaced TMJ disc is this dark black bundled up tissue. This is a lateral head x-ray of this patient showing the missing posterior teeth on her right side. Notice the very, very great discrepancy between the inferior border of the mandible on the right side and the inferior border of the mandible on the left side. This is a very great discrepancy between the two sides of the mandible. Again, she has suboccipital tissue compression. The black column represents a very impaired airway. Compare it to some of the ones you have previously seen. This is a lateral skull x-ray showing the patient's neck. Again, notice the airway, the inferior border of the mandible discrepancy, the suboccipital compressed tissues, but notice the lack of intervertebral joint space. There's supposed to be a 3 to 4 or more gap between each vertebrae. These are completely eliminated on this patient, which is a sign of severe osteoarthritis of the cervical spine. These black areas are intervertebral foramen that are not supposed to show up on a lateral skull x-ray. They show up only on an oblique x-ray where the head is deliberately turned 45 degrees to pick up these intervertebral foramina. You can see that some are quite small. This is compression of the intervertebral foramina, which encroaches upon the nerves that exit out of these foramina into the neck and down the arms. This is a torticollis patient that presents today for treatment. You can see how she has a left head tilt and the face is twisted to the opposite side. I have come to the conclusion that these patients all have an internal derangement, and we have had this patient get an MRI which has documented this. She also has severe condylar osteoarthritic degeneration of the right TMJ condyle, as documented by this MRI. This, of course, results in the mandible being malaligned to the cranial base, causing a decreased vertical dimension. You can see that she has at least a 50 or 60% overbite here, so she has a decreased vertical dimension. The majority of these patients will have a decreased vertical dimension, which results in compression of the temporomandibular joints and their contents, particularly the fibers of the auriculotemporal nerve, which feed into the trigeminal nerve. Consequently, we wish to decompress the contents of the temporomandibular nerve, and we do this by trial and error with these various tongue blades. Now we're going to have this patient close her eyes, and we are going to insert these tongue blades in her mouth, and we're just going to start with 5 tongue blades. Okay, just close your eyes and open your mouth and put these in, and we're going to have her sit here for a while and just watch what response we receive. You can see from this test that the cervical muscles start to release and the patient's head starts to turn slowly but perceptibly to her left. The longer we let her sit here like this, the more it will turn to the left. This indicates to me that this patient needs more support on the right side of her mouth. She is also missing teeth, molar teeth, on the right side of her mouth. So we are going to build her a mouthpiece that will replace these missing teeth, plus give her additional support to suspend her mandible away from her cranial base and essentially replicate the function that these tongue blades are providing temporarily. I'm just going to increase this open. Close. Although it may seem longer, the patient has had the tongue blades in her mouth approximately 3 minutes. And you can see that at this point in time, her head is almost erect and her shoulders are just about level. To me, this is a good sign and indicates a good starting point for her mouthpiece. Now, open. What I'm going to do is just put these on one side. Bite. Okay. Now, just close your eyes and just sit here for a while with that. Let's see what that does for you on that side. Another clinical test I frequently use is to put the tongue blades in on one side only. This is usually the side to which the head is turned. That is the side I think needs the most support. As you can see, I put it in on this patient's right side. It's important to have the patient close her eyes and just sit as quietly and peacefully as possible and let nature take its course. This is what we're doing on the next day. Notice how erect the head is and how level the shoulders are. Okay, how'd that feel?
Relaxed.
Yes. Is that probably the most relaxed you've been in a while?
Ages.
In ages, huh?
20-some years.
20-some years. Huh? That's pretty good.
Yes.
Well, that gives us an indication of where we need to start, the height we need to make the appliance. Okay, bite. Bite. Here I am fitting the appliance to the patient's mouth. Okay. Okay. Now, let me take this out a minute. Let me put these back in just now. Okay, bite. Okay. Okay. This is the final product at the end of the first day appointment. We made this 8 tongue blades high on either side, and it improved the patient very much so, in our opinion. But we thought we could improve it even further, so we added the 2 more tongue blades in height to the right side and put it in the patient's mouth, which we're going to do now, and then dismiss her and see her 2 days from now. And you can see the effect when we put it in, fitting over her lower partial denture. Bite. And this is how much it opens the patient up. Don't let this increase in vertical dimension shock you. This is what it takes initially. Doesn't mean we're going to keep the patient at this height throughout the course of treatment. We're going to attempt to lower this as her symptoms subside. But you can see it causes the patient's muscles to relax and go out of spasm. And she'll describe to the audience what she is experiencing as this sits in her mouth the first few moments.
Experience a release of the tight muscles that I've had for so long, and a relaxation that I have not had for a long time, and above all, I guess I'm able to keep my head straight. Because before, it always wanted to rest on my right shoulder.
Tell them in years how long it's been.
It's been probably 22 years that I've had this condition, and my head has tried to always pulling to the right. It's a constant battle trying to look straight ahead, and the muscles have been extremely tight and very painful also. Sometimes it's extremely difficult to get to sleep. I've been limited in all activities, and this is totally different, being able to look straight ahead and to keep my head straight. muscle relaxation is really amazing and relaxing. I can feel the difference. And it's gradually increasing the relaxation the longer I have the appliance in my mouth. I can feel the difference.
You want to stand up and see if there's a difference in standing?
I feel like I'm a little taller, but it's great to be able to look straight ahead. And I know there'll be a big difference in driving rather than having to fight to keep my head to the front all the time. So it's just totally different.
Your shoulders feel more level, straighter?
Much more level. I feel I'm getting more space in the diaphragm area, and that my head is coming more into the correct position that it should be. I can't really tell completely since I can't see myself, but it feels much more comfortable and at ease. My right shoulder is relaxed so that it's not pulling. Normally it would pull so that it almost touches my right ear, and my neck would go down so that the right ear and the right shoulder would almost touch. So I feel it's a vast difference. The longer I have this in my mouth, the more changes, subtle changes, I can feel.
Okay, that's the first 5 minutes of treatment. We will take some more footage 2 days from now and show you that. And this is how we treat these torticollis patients. Okay, go walk up to me. Okay, this is the patient walking. Okay. Now, is that an improvement in your walking?
Yes.
Okay.
I have much better balance. I can walk a much straighter line, and my feet don't flare out.
Does it feel more secure when your feet hit the ground?
Oh, much more secure.
Because that's a problem as you get older, feeling unstable and falling.
I didn't really have that feeling. I felt very secure. And
Have you had that
ease
feeling
walking.
in the past? Have you had that feeling falling?
Oh yes. I've not been able to walk in a straight line. If I go outside, I wander all over the sidewalk, and also I've had to put my hands like this to keep my head forward so that I could see without sunlight.
This is our patient who returns 14 days after we last saw her, a total of 20 days since she received her appliance for torticollis. Tell the audience what's been happening in the last 20 days since you received your appliance, what difference it's made, what other people have said, etc.
Well, I've had a lot more energy. I've been able to go like all day long, and matter of fact, I just returned from a cruise, and I was able to go and to go on the sightseeing trips and to go all day long, whereas before in the afternoons I would begin hurting so much I'd have to stop and take a rest for 20-30 minutes, but I continued, on the cruise and all. I was able to go. Yesterday we drove for 10 hours. I feel fine today. I don't have any hangover from it and such, so I have lots more energy and generally feel much more upbeat relaxed. I used to find myself leaning forward at times, and now I find I stand up straighter much more often, and even feel like pulling in my stomach, and just having a more aware of my posture, whereas before it was just simply trying to get by, trying to get through the day. So, and the tension, and don't have any tension in my shoulders or my neck that I used to have. So all that has increased, gotten much better.
The inclination of your head and neck is much better, and you certainly are talking a lot more clearly. You're not having any trouble with the appliance, are you?
I have a little trouble eating some, but I'm learning to adjust to that. And I think once in a while I get a headache. I don't know if it's from the appliance or it's, adjusting, or it's otherwise.
Okay.
But that's about the only question I would have, is really about the occasional headache. Though I've had headaches before, I can't really say it's due to the appliance.
Okay. Excellent. Okay, this patient returns after wearing the appliance for 7.5 weeks. She reports that she has had a lot more energy and she is sleeping better. She has no headaches, which she had for once a week for the previous two plus years prior to coming to see me. Things are progressing right on schedule as far as I'm concerned, and the patient's doing very well. Would you care to say something to the audience?
The biggest change I have noticed is the tremendous amount of energy that I've had. Yes, that's not really a tremendous amount, it's that I lacked an energy before. If I would do housework after an hour, hour and a half, I had to take a rest. Now I keep going.
So are you feeling any better the last day or two?
Yes, I feel less tension in my neck and shoulders. Actually, they feel relaxed, normal, and it's really a great relief. And I felt some movement in through here, and just generally I felt much better.
Your head doesn't want to turn as much as it was?
Oh, my head doesn't turn nearly as much as it does. It used to be a constant struggle, just a constant battle, but now it stays mainly straight. Even the shoulder, which had built up a very hard area, is not as hard now. It's softened because of the turning has lessened. So it's much, much better. But to be free of all this tension and tightness to my neck and all across my shoulders, it's really been a tremendous help. And that happened very quickly with having the appliance.